The development of the stent, which is a tube designed to be inserted into a blood vessel to keep it open, has saved many lives. Dr. Subbarao Myla of Hoag Memorial Hospital Presbyterian in Newport Beach explains how this small device is being used.
Carotid stenting is a non-surgical way of fixing the artery in the carotid. As you know, carotid blockage is one of the most common causes, treatable causes for a stroke. Carotid artery disease most of the time is silent. That's why we call it a silent killer. So there are some clues to look for it. If someone is having a sudden transient blurred vision, one eye or both eyes, or in their field of view they're seeing black spots, those are early warning signs. Slurred speech, memory impairment, not thinking right, these are the early signs. So they may present with clumsiness in the hand, or their foot is dropping, they're catching on the carpet and falling because the right foot is weak or without balance. So any of these symptoms of carotid disease should be a warning sign that they should get medical attention right away.
How is the procedure performed to insert a stent?
Carotid stenting is done with an overnight stay. Local anesthesia is needed in the groin, where we puncture the skin and then insert a tiny needle. Through that we advance catheters using x-rays. And at that point we use an important device called carotid filter. Carotid filter is a tiny little umbrella. It comes compressed in a tiny little tube, and we navigate that through the blockage and we deploy it just below the brain. What it does is it removes any particles that is loose coming and won't allow it to go into the brain. So that's how strokes happen. By blocking the particles, trapping them, you increase the safety of the procedure. And after the balloon angioplasty is done, and then we deploy the stent. Now, stent is the only permanent part that stays in the carotid. Body makes a nice lining over it and incorporates that stent into the walls. So a month later, you go inside and put a camera, you won't find the stent. It's like a permanent good scaffold. The blockage is pushed into the walls, and whatever loose particles are there, we trap it and take the filter out. The entire procedure typically takes about 20 minutes. We keep them overnight just to make sure their brain function is okay. Where we punctured, it is stable. We don't cut anything, and then the next day they get up and go home.
What is the success rate of using stents?
The success rate is in the range of 98%. There is a small chance of a major stroke. We think it is around 1%. Minor strokes do happen. See, the filters strain most of the big particles. Because we need to allow the blood flow to go to the brain, we do allow microscopic particles to go. So it is possible minor strokes may happen. Fortunately, they are very small in number, and majority recover completely. Hoag Hospital, we have done close to 400 patients, and our results have been very good. We compared our data across the nation, and our stroke rate, including heart attack and death, is 3.7%, comparing to the published data in the range of 6 to 7%. We have done very well.